The White House task force has now identified the Detroit and Chicago areas as potential new hotspots. Cases in Illinois have nearly doubled in the last 3 days, now at more than 2,500. 75% of the state's cases are from Cook County, 45% from Chicago alone. Meanwhile, in Michigan, the number of reported cases have quadrupled since Monday to 2,800, with nearly half coming from Wayne County, 30% from Detroit alone. Yet while Michigan braces itself for a deluge of cases, there is a harrowing report regarding the life and death guidelines to be used at a hospital network there during this pandemic. The Detroit Free Press reports that the Henry Ford Health System officially confirmed the accuracy of a detailed letter being circulated by doctors and others on social media, which outlines how doctors would make decisions at the Michigan Hospital Network about who gets treated during the COVID-19 crisis with limited resources. The letter reportedly reads in part, "Patients who have the best chance of getting better are our first priority. Patients will be evaluated for the best plan of care, and dying patients will be provided comfort care. Some patients will be extremely sick and very unlikely to survive their illness, even with critical treatment. Treating these patients would take away resources for patients who might survive. Patients who are not eligible for ICU or ventilator care will receive treatment for pain control and comfort measures. Some conditions that are likely may make you not eligible include severe heart, lung, kidney, or liver failure, terminal cancers, or severe trauma or burns." It continues. Patients who are treated with a ventilator or ICU care may have these treatments stopped if they do not improve over time. If they do not improve, this means that the patient has a poor chance of surviving the illness, even if the care was continued. This decision will be based on medical condition and likelihood of getting better. In response, the healthcare network explained that explaining the letter is part of a larger policy document developed for an absolute worst-case scenario. And it's not an active policy, but part of emergency response planning. But we have a lot of different states and hospital systems around the country that are dealing with similar issues. You know, in Boston, Eddie, 160 healthcare workers across at least 3 hospitals have coronavirus. They are going to have an outbreak among their healthcare community. And these healthcare workers, once again, there's no plan in these cities to put them anywhere to isolate when they go home to their families. So they are becoming spreaders. And there are asymptomatic carriers as well. These healthcare workers are exposed to it on the front lines every day. They have nowhere to go. They have nowhere to isolate. The government is asking people to 15 days to slow the spread, to self-isolate, whatever, to contain it, to social distance. Healthcare workers have nowhere to go. It's not possible in these major cities. It's actually a joke, what they're trying to ask these people on the front lines to do. And we have a little bit more here, Eddie, in terms of the hospitals. These protocols are being talked about at Chicago hospitals, at hospitals in New York City, because they don't have the supplies to help these people. Doctors are being put in a horrible position where they have to decide who lives or dies. What's the way out of this?
You know, John Meacham said a reason, right, to listen to we've been talking about since we've been discussing corona. Governor Cuomo told us we would get here, at least those of us who were listening. And you think about not only what's happening in New York or in Chicago and Detroit, but think about New Orleans, Mika. Think about the Deep South. Think about Florida and Alabama, and Louisiana and Mississippi and Arkansas and West Virginia. We have the governor of Mississippi, for example, opening up that state, overruling mayors in my own hometown of Moss Point, Mississippi, putting my mother and father in danger. And so what we see here is the grimness, the grim reality of the moment we're in. And we need not small-minded people, not selfish folk, but folk who have a sense of the actual stakes, current circumstance. And it just seems to me, Mika, right now we need someone to level of the crisis and not be small, be as large as.
And Willie, guys, just to add to the scenario in Boston, which is really developing before our eyes rapidly into a crisis, a full-blown crisis, Massachusetts. Now, the head of the Massachusetts State Hospital Medical Education System, they seem to see what's coming. I'm not sure why the president doesn't, but Massachusetts has become the first state to graduate all fourth-year medical students to try and expand the capacity of the medical population. They know that they are going to run out of doctors at the rate they're going. They can see it. Why can't Washington?
Yeah, there's a rush, not just in Massachusetts, but
across the country to get doctors. And Chris Lu, this is what we're looking at. We just lost Willie's audio. Is that when you have healthcare workers that are exposed and you have these numbers, and again, we have such limited testing, Chris Lu, we don't actually know what we're looking at. Let's back up to where we are. And in terms of Washington's reaction from the get-go, we are still in the dark today in terms of testing. We still don't exactly know where we stand, but the numbers we're getting show medical workers, healthcare workers, and those on the front line, police departments that have dozens, sometimes hundreds of cops out. The frontline workers need to be isolated. If the government wants Americans to social distance, why wouldn't they set up a situation where they open up all hotels and all empty properties right now and step up like Airbnb is, companies are, and try and help people separate? You have these congested areas with people on the front line who have no way of social distancing.
You know, Mika, everything needs to be on the table right now, whether it's using hotels that have closed for isolation, whether it's far more protective standards for frontline healthcare workers. But I think it also speaks more broadly to the flaws of this plan that the president wants to use to open up county by county. Because if you do that in a world in which you don't have broad surveillance, the counties that are going to open up quicker are going to be the rural counties. And we know those rural hospitals don't have surge capacity. They don't have the sophisticated equipment. And so you're then going to see a greater flood on the problem with the health care, particularly in those rural areas.
Thanks for checking out MSNBC on YouTube, and make sure you subscribe to stay up to date on the day's biggest stories. And you can click on any of the videos around us to watch more from Morning Joe and MSNBC. Thanks so much for watching.